Hi everyone, I'm Dr. Motahare and welcome back to the Art of Medicine from Anatomy to Diagnosis. Today we will talk about a common and often uncomfortable condition, external otitis, also called swimmer's ear. It's something many people deal with, especially during summer or after swimming. And I'll explain what causes it, how to treat it, and most importantly, how to prevent it. Let's start with the basics. What is external otitis? It's an inflammation or infection of other ear canal, which is the part of your ear that runs from outside of your ear to your eardrum. It often happens when water gets trapped inside the ear, creating a moist environment where bacteria or fungi can grow. That's why it's commonly known as swimmer's ear. What are the common symptoms? The symptoms can vary from just a little annoying to really painful. You might feel pain when you touch your ear or pull it out. This is the hallmark of external otitis. There could be some kind of itching, redness, swelling, or fluid coming out of the ear. Some people may notice hearing loss or feeling like the ear is blocked. There are a few different types of this condition. The first one is acute otitis externa, which comes suddenly and is usually caused by bacteria and sometimes fungal elements. The second one is chronic otitis externa, which lasts more than 6 weeks and might be linked to things like eczema or allergies. Eczematous otitis is related to skin conditions. And finally, and most importantly, malignant or necrotizing otitis externa, which is a rare but really serious form that mostly affect people with weakened immune system, like people with diabetes. So what causes swimmer's ear? Most of the time, it's bacterial infection, especially Pseudomonas. Other times, it's fungal. Think like excess moisture, injury from the cotton swab, especially cotton swab, or scratching the ear canal can make things worse. Even skin conditions like eczema can make your ear more vulnerable. You might think it only affects swimmers, but actually not. Many people are at risk. These include people who inserting anything into the ear, that's scratching. People who use hearing aids or earplugs frequently, diabetic patients, elderly individuals, and those with skin conditions like eczema or psoriasis. Basically, if your ears stay moist or irritated, you are more likely to develop this condition. Here is where things get worse, serious worse, especially for people with diabetes or weakened immune system. In these cases, swimmer ear can turn into malignant otitis externa. That means that the infection spreads deeper into the tissue and even bones around the ear. It's very painful and needs immediate medical attention. It's some kind of emergency. Sometimes the hospital care and strong antibiotics. So don't ignore the ear pain, especially if you are in those high risk groups. But the good news is that external otitis is very treatable easily when caught early. A doctor may clear your ear and prescribe antibiotics ear drops. If there is inflammation, steroid drops can be helpful. For pain, you may use acetaminophen or ibuprofen. In cases caused by fungi, antifungal drops are used. Just remember, don't put anything into your ear unless your doctors tell you to do. Let's talk the most important part, prevention, because no one wants swimmer's ear. So to protect your ear from this disease, always dry your ears after swimming or showering. Do not insert anything, not even cotton swabs, nothing. Avoid dirty waters when swimming. If you are prone to infection, talk to your doctor about using, for example, some kind of preventive air drops. These small habits go a long way in keeping your ear healthy. Thank you so much for watching. I am Dr. Motahare, and this was another episode of the Art of Medicine from Anatomy to Diagnosis. If you found this helpful, please like, subscribe, and share it with someone who might benefit. And don't forget, keep your ears dry and safe. And see your doctor if something feels off. Take care and stay healthy.